77-year-old male, ankle pain. What's the diagnosis? You're presented with a lateral x-ray and an axial MR image through the ankle. And on the x-ray, we can appreciate that there is some type of lobulated matrix seen at the anterior aspect of the articulation. It's likely interarticular and it's in the space that it's occupying. And of course, the MRI truly helps us to see that there are innumerable foci of round elevated signal, all measuring roughly the same amount and even creating erosions of the bone itself. Putting those two thoughts together, the diagnosis is primary synovial osteochondromatosis. With regards to the MR appearance of synovial osteochondromatosis, which is correct? Is the adjacent bone typically not eroded? Does it typically show low MR signal and blooming? Are the bodies usually low on T1 and high on T2? Is the involved synovium not enhancing? Which of these is correct? You bet. The bodies are usually low on T1 and high on T2 because they're composed of hyaline cartilage, and it's most commonly found at the knee, 50% of those cases. For the other answers, the adjacent bone typically does have erosions, and the entity that usually demonstrates low signal with blooming is pigmented villonodular synovitis, or PVNS. And in our case, it's true. The involved synovium typically enhances in synovial osteochondromatosis. Furthermore, diving deep into synovial osteochondromatosis, this is a benign monoarticular disorder of unknown origin characterized by synovial metaplasia and proliferation. Multiple intraarticular cartilaginous loose bodies, similar in size. Some, but not all, may be ossified, or all. They have a variety of presentations. Presenting in middle age, fourth and fifth decades of life, adjacent bone typically has erosions up to 80%. And the differential diagnosis is of a joint process. So we're going to include things like PVNS, pigmented villonodular synovitis. We know that blooms. We know these bodies are usually composed of hyaline cartilage, most common at the knee, and that the synovium typically enhances.